There is a lot of misinformation out there, and patients and their advocates need to approach things with skepticism. But one of the things that we naturally do as human beings, just because of the way the brain is wired, is we tend to vacillate from black to white, all, nothing, right, wrong. So we tend to, if we ask our oncologist a question and we know they're not giving us the full story, we know there are more options, but they're telling us we just have to do chemo, for example, and we know that doesn't quite feel right, the natural tendency in the brain is to go to an extreme, meaning away from allopathic or standard of care entirely and over into a more alternative therapeutic approach. That's not a good idea, folks. There's a time and a place for certain alternative therapies, supplements, things like that to help you, certainly. But the idea that standard of care or your doctor in the medical system has nothing of value to offer you, that's not true and not in your best interest to think that way. What you want to do is become really well educated about what good science-based medical evidence is. How do you know when something actually has merit, when it is a proven therapy that's going to benefit you? The faster you can become educated about how to tell the difference between when a therapy has good medical science base and you could therefore get a doctor to prescribe it because there's a defined mechanism that's right for you versus something that is wishful thinking, hopeful thinking, anecdotal evidence, might have been right for Mrs. Smith, but is not right for you. The faster you can figure out how to discern these two things, the less anxious you're going to feel, the more confident you're going to be in your treatment plan, because it's going to be a lot easier for you to make sure you're making the right choices.